Okay, everybody, we're going to get started. Good afternoon. Welcome to the first CAS webinar of 2020. It's been a slow going year. We were supposed to have this back in March, but obviously with all of the changes that we've had to make, we needed to push that back. So thank you for joining us today. My name is Allison Delcalzo-Behrens. I'm the HIV counselor at the Family Health Center of Morristown Medical Center and the chair of the Morris County Community Assistance Services Committee, or CAS. Today's webinar is on SOAR and PATH. SOAR stands for, or SOAR stands for SSD Outreach, Access, and Recovery. In this webinar, you will learn what this method is, who are the qualified candidates, and how to help individuals access benefits using this method. The webinar will also cover what PATH services are and who qualifies for services and methods used to end homelessness for people with mental illness. As Danielle mentioned a few minutes ago, this is not like a training for how to do SOAR and PATH. It's a longer training. This is more about the information that you need to understand how to connect your clients to the resources. And I believe that MHA is an organization that you can refer clients to help do SOAR. So before we start, there are a few housekeeping items I would like to review. This webinar is being recorded and will be uploaded to the CAS YouTube channel either today or tomorrow. Comments and questions are welcome. You can enter them into the chat box, or if you're connected to audio and you're not interrupting the presentation, you're invited to make comments or ask questions through audio. Just please remember that we are recording, so any questions that you ask out loud are questions that will be recorded, or any comments that you make as well. And again, if you could please try to refrain from interrupting the presentation, that would be great as well. We do have about 20 people on the call so far right now, so if you could take control of your own audio and make sure you're muting yourself, that would be great. That way, I don't have to mute anybody. And in case you do want to take yourself off mute and you do want to make a comment or ask a question, you can do that without having to raise your hand or anything. So I'd like to introduce today's presenter. Danielle Pera is the director of PATH for the Mental Health Association of Essex and Morris, and the chair of the Project Homeless Connect subcommittee for the Morris County Continuum of Care. Thank you for being with us today, Danielle.
You're welcome. Thank you for having me, Allison. So like I said, I'm a little bit nervous. I've never done one of these before, so it might be a little bit clunky. And this is just an information overview, like Allison said. So let's get right to it. Hold on. I'm already having problems. Okay. So the learning objectives for today, which kind of went over because it was part of the flyer, is that we're going to overview what the SOAR method is, who are the appropriate candidates to utilize this method, how the approval process works through DDS. So that kind of will give us a little bit of an insight into how they make decisions about these applications, what PATH is and how we have attempted to implement SOAR into our applications, and how you can get trained on this and how you can get your staff trained on how to implement it yourself. So what is the SOAR method? That is the burning question on everyone's mind right now. So it is the SSD Outreach, Access, and Recovery. Is a program that is designed to increase access to Social Security Administration disability benefits for eligible individuals who are experiencing or at risk of homelessness and have a mental illness, medical impairment, or co-occurring substance use disorder. For more than a decade, the SOAR approach, I'm hearing an echo.
That's me, I'm sorry.
Okay. So
are you able to mute yourself?
Yeah, somehow I muted my phone, but I didn't mute my computer.
Hope that explains it.
Oh. Is there anything that we can do on our end?
Yeah, let me. Is that better?
Testing. Okay, no echo. Good, thank you. Okay, so for more than a decade, the SOAR approach has been used to assist people who are experiencing homelessness with applications for Social Security and disability benefits, which include SSI and SSD. 65% of the applicants that use the SOAR method have been approved for SSI or SSD upon the initial application. So that's important, and that is what SOAR kind of pushes as their big selling point, is that a large number of the applications that are submitted are accepted the first time, so that you don't have to go through the appeals process and have to get legal aid involved and go through all of that. That delays everything and makes people wait upwards of 2 years sometimes for benefits. So we'll talk a little bit more about that. The decisions on SOAR-assisted initial applications are received on average in 81 days, which is also information directly from the SOAR statistics. Training in this method teaches you how to write comprehensive applications for specific populations in order to get their approval done as quickly as possible. But first we have to understand who the appropriate candidates are to use this method. So SOAR is specifically designed for people who are experiencing homelessness or at imminent risk of homelessness. It's targeted towards individuals who have been in jail or prison and hospitals, or have just been homeless for a very long time and show signs of mental illness, co-occurring disorders, and other disorders that impair cognition. So the impairing cognition piece is important because that is really what we're focusing on, is why can the person not work as a result of this impaired cognition? That's what the focus is on. So SSA has not fully revised their listing of mental disorders since 1990, but there has been a revision in 2010 that includes some expanded diagnoses that would be considered appropriate to use the SOAR method, as long as there is a strong documentation to support the disability and why work is not possible in that instance. So the candidate's illness or condition must have lasted or expected to last for at least 12 months or expected to result in death. Applicants are not working due to medical or psychiatric conditions, not because they can't find work or were laid off. There should be a history of failed work attempts, like they started and stopped employment due to the diagnosis and disability, which we do see this a lot with people starting work. They might only keep it for a couple of months. They either get let go because of certain issues, or they end up quitting because they can't handle the stress and the consistency, or whatever it is. If there's a pattern of attempted work trials that have been unsuccessful, then this would be an ideal candidate as well. And if you can document that pattern, then that makes it even stronger. If they have a long work history but can no longer work up to the SGA, which is a substantial gainful activity amount, which is $12.60 a month as of 2020, specifically due to their condition. So this is the list of appropriate disorders that I pulled from the SOAR website that are as of 2017. So we have neurocognitive disorders, schizophrenia spectrum and other psychotic disorders, depressive, bipolar and related disorders, intellectual disorders, anxiety and obsessive compulsive disorders, somatic symptom related, personality or impulse related, autism spectrum disorders, neurodevelopmental, which have an onset of childhood or early adolescence, eating disorders, trauma and stress related disorders. Now, having the diagnosis simply doesn't get the approval. A lot of people can have the diagnosis, but there has to be this consistent pattern of impairment. So the applicant is prescribed psychiatric medication and continues to experience symptoms and functional impairments, even despite treatment. And the applicant has obtainable medical evidence for at least the better part of 12 months that corroborates mental illness and medical complaints. So this comes back to the documentation and the patterns of why employment is not possible at a substantially gainful level. Let's see. So if there's limited medical evidence or large gaps in treatment, because sometimes that can happen with individuals who have been homeless for a very long time, particularly our chronic population, they might not have a treatment history. They might never have seen a doctor. And particularly the ones that we work with in PATH that we pull out from some of the depths of the woods sometimes that haven't seen anyone, have had no diagnosis. We have to work on building that support and that documentation to show the patterns that are required to get approval. So in absence of that, the applicant should clearly exhibit symptoms of severe enough that a one-time examination by a physician would demonstrate an issue. The representative can write a medical summary report that details symptoms and functional impairments that demonstrate that diagnosed disability. So the medical summary report is a key part of the SOAR method in writing all of that out and going through all of the individual functionalities and where the impairments lie in order to get the best approval. So the applicant is not working due to medical or psychiatric conditions, not because they can't find work or were just laid off. So they have to have an actual impairment. It can't just be that they're having difficulty finding work, which I think kind of goes without saying. And then it goes into, again, the history of failed work attempts, so they started and stopped employment, or if they've had a long work history, but their impairment has caused them to fall below substantial gainful activity level. So we have a lot of times people might have high-powered, well-paying jobs, and they become very, very sick, but they're not able to go back to the type of work that they had before. Now, that in and of itself doesn't necessarily always mean that disability is determined, because they could do different type of work. It might not be what they were making before, but DDS and SSA look at it from that perspective of what type of work can they do before they issue a check. And also the scattered work history due to conditions and other factors is something that strengthens the application. So this is a little flow chart that I pulled off of there to kind of help us understand what the process is for a disability application and what they're looking at and how they determine whether somebody's disabled or not. So I pulled this little flow chart off of their website. So step one, obviously, is the person working. If they are, then they're going to get denied. If they're not, then we move on to step two. Does the person have a severe impairment? So that's where they're going to start looking at their, functionalities and what the impairment is. If DDS determines that it's a significant enough impairment, then they may go on to step three. If they don't, then they're going to deny it right there at step two. So I'm going to actually move to the next slide and go on to what each of the steps are in a little bit more detail. So step one is the applicant working at substantial gainful level. Gainful work activity is work performed for pay or profit, or work intended for profit, even if the profit is not realized. Each year, SSA sets an amount of gross monthly earnings that are considered to be SGA. So there's that number again, 1260. That's the magic monthly amount as of 2020 that is considered to be substantial. The type and amount of support that individual receives while work is taken into consideration when determining SGA. So if they're needing any type of support in order to maintain that work, then that can be considered as well. SSA will evaluate the applicant's work activity. If the applicant is working and earning gross monthly wages equivalent or exceeding the SGA, the claim will be denied. So basically, if they're making more than that, then they're automatically going to be denied if they're making more than the minimum. So this is just that's how step one works. Basically, are you working? Are you making enough money on your own? If yes, you get denied. If no, then we're going to move on to step two. Does the applicant have a severe impairment? So they consider, SSA considers medical severity of the applicant's medically determinable impairment and its duration. So they want to look at, is this going to be a forever or is this going to be temporary? So most of the candidates that we're looking to work with, we'd be looking for permanent disability, not temporary, because the understanding from our world is that these people have been struggling for so long that they just cannot get back into a substantial gainful earnings at this point. So case managers can help by clearly and accurately presenting information about the person's functions, which in the full training, they do discuss how you can write that out and how you can explain how the individual functionality is impaired enough that work is not possible. And this really does take knowing the person and working with them for a long time. It's not something that we can kind of just get on an initial intake. You know, there's a lot of people that just go to a psychiatrist, get an evaluation, and the person meets them once. The psychiatrists are most likely not going to be able to evaluate those functional impairments on one intake, unless it's so severe that they can. And then we're talking about the more cognitive impairments that are visible. But some of our people that we serve do not necessarily always present with those impairments at the first time, and we do have to work a little bit harder to show how that impairment is affecting them and affecting their ability to work. So what DDS is ultimately the body that decides whether the person is disabled or not. So they would consider the things that they can do physically, such as can you stand for a long period of time, can you walk, can you lift heavy things, can you see, can you hear, can you speak? Those are the basic things. So if anybody can do those things, that's most likely going to lead to a denial if you can do those things, because then in their mind that means, well, you can do a lot of things as long as you're able to maintain those skills. Now, the mental activities such as understanding, remembering, carrying out simple instructions, having judgment, responding to supervision, and dealing with changes, those are the more mental activities that if you can't do those things or you struggle with those things, those are the impairments that they're looking for in order to accept an application as this person is disabled, if that makes sense. So if the impairment is considered to be severe enough at that moment, then it moves on to step 3. If the impairment is not severe enough in those 2 areas, then the chances are that it's going to get denied. So like I said before, a serious illness is not equivalent to a severe impairment. For example, a person diagnosed with bipolar disorder may be able to manage his or her illness, complete activities of daily living, may have healthy ongoing relationships, complete cognitive tasks, and so on. Clearly, bipolar disorder is a serious mental illness, and there may be times when it's difficult to manage. However, many people with this disorder function very well and are capable of work. And if a person does not have the severe impairment, then the application will be denied. I'm sure some people sitting in this room have probably experienced this with consumers that they've served. You know, the diagnosis isn't always enough. Those are the impairments that they look for, which if you take this full training, you will learn a lot more about all of that. So step 3 is what SOAR considers to be the sweet spot. If you can get the application approved in step 3 by writing out these comprehensive evaluations and hit on all of the impairments that DDS will look for, then you'll have better success with your application. So there is a full listing of those impairments, and you can learn more about that full listing in the full training. And this kind of just goes back again, like the diagnosis alone is not enough. You know, you have to have evidence of those impairments. So step 4, does the impairment allow for past or relevant work? So again, the other thing that DDS will consider is if there are impairments that are significant, they may even evaluate, well, can the person do something different than what they did before? Like I was saying earlier, it is possible that people can, you know, fall out of work and not be able to return to the same level of skill that they were previously, you know, able to do, but they might be able to do something else that might not make as much money, but still could be potentially gainful enough for them. So this could be a dangerous area where they could get denied. So then this is, step 5, can the person do any other work? So they're going to look at what other types of things that are possible. And I've seen this a lot where, okay, the person, you know, they might be experiencing depression, and they may have disability for a time, or they may be out of work for a time, but once it's resolved and once they're able to get their treatment back on track, the expectation is that they'll most likely be able to return to some functional workability after that. So that's where you would do a temporary disability or even a protected leave of absence, FMLA or something like that, to cover the person while they're recovering and then be able to return to work. So then disability would not be looking to approve somebody that can potentially do that. So again, step 3 is key, and when we're working with individuals who are experiencing severe mental illness and they're experiencing severe impairment that prevents them from working, our goal is to really try to get that approval in step 3. This way there's less of a wait time. And there are some barriers to this, which I will actually talk about, but this is really where we would like to, and where SOAR can really help us get quicker approvals for any of the agencies that are working with this population. So here are, and you guys will have a copy of this, and it will be listed on YouTube, I believe Allison said. So this is the website for SOAR and how you can access the online trainings. The trainings are free, they're online. There is a process where you do have to actually submit written, what do they call it? It's, I forget the name of the document, but it's part of an application that you would have to submit, and they review it. The SOAR Center actually reviews it for you and gives you feedback on whether your application is strong enough in order to get an application passed. And they give you a fake case, and you're supposed to compile a document to support their application. Quite interesting. So what is PATH and how do we use SOAR? So PATH is, for those that don't know, is we are a project in assisting with transition from homelessness. And our program is designed to identify individuals who are homeless or at imminent risk of homelessness and are diagnosed or suspected to have a severe mental illness. So our mission with SOAR kind of goes hand in hand, because we're out there trying to target people who need this service and who are homeless and have a disability and have not been able to work, and try to get them income. That's a lot of times our first priority, is to make sure that people have substantial enough income. So PATH can engage an individual if there is no documentation, but once documentation is obtained that shows that the person does not have an illness that meets the criteria, then the case would have to be terminated. So I personally don't like to run it that way, because I feel it kind of gives a client false hope. So I like to try to, whenever possible, get documentation if they are already in treatment or have a history of treatment. Oh, sorry, hold on. Because if they do have a history already, then that kind of already determines for me if the resources that we have can help them or not. Because if they don't have something that qualifies, then it will be more difficult for us to use the resources that we have to help them. So our main goals as PATH is to link a homeless individual to mainstream resources, which would be disability benefits, so financial, employment whenever possible, temporary and permanent housing, substance abuse treatment, health insurance, and health care. So those are the things that we cover. Those are our contracted linkages that we're supposed to make in the community. And the PATH staff are trained in SOAR to identify potentially eligible and appropriate candidates that would benefit from using this model. So the path to success, no pun intended, is that the PATH staff ideally would work with providers to strengthen the disability applications, and that's if there is cooperation. A lot of times with providers, it is really hard for the caseworkers to be able to give that input, and a lot of times the prescribers or APNs might, do the documents on their own when disability requests feedback from the provider, and they might not be hitting on the points that are needed in order to get an application passed through on the first try. And then we see a lot of people kind of coming into the appeal process and having to fight for that benefit. So if there was a potential for there to be a little bit more collaboration in that area, I think there would be more success. So, we want to get them approved at the step 3, and I think that would really help. The other thing that would probably be helpful would be to get our local SSA office on board so that they could maybe kind of notice our applications first, to kind of help get things passed along a little bit more, which that might require fostering some relationships there. So that's basically my thing on that. I think that would be helpful if we can kind of pull all of those things together. So yeah, and I mean, there is criteria for a reason with disability. We don't want to encourage people who are capable of working to not, and just say, you know, I'm not going to do this. If there is a skill or if there is a potential for work, then that is encouraged through SOAR as well. And SOAR has, you know, even turned people away or chosen not to work with a specific candidate if they feel that they're not appropriate to use the method. Because it is only a method. It's really not anything magic. I mean, SSA doesn't look and be like, oh, this is a SOAR application, we're going to approve it. But the hope is that if they see this application coming with SOAR support, that it'll show them, okay, well, this is going to be a good application. It's going to have the information we need. So maybe we can, you know, pass it along more quickly because we know it's going to be comprehensive and it's going to answer a lot of the questions for us that they would have to ask through those extended review processes. When you go into appeals, they go into more depth about all these functionalities. But if we can hit on all those targeted impairments first, then that should put us into that step 3 approval. So that's all that I have on those things. If anyone has any questions, I don't know if we want to do the chat box for questions. I see the only question is if we can get a copy of the PowerPoint. I think we touched on that, Allison, if you want, I can send it to you and you can send it out to everybody.
Absolutely. So yeah, I think I put 2 people on mute. Let me see if I can take them off because we were getting feedback.
Mm-hmm.
So I don't know.
Okay. So caller 6 is I'm going to mute you, caller 6. But everybody else should be able to have access to audio. And if not, sure, you can put your questions in the chat box. Just if you want to ask a question and you've muted yourself, make sure you take yourself off mute. So I did have a couple of questions. I can start it off. So I had a question about the permanent versus temporary disability. So can someone apply for temporary, or were you saying that if it's going to be temporary, then they should go to an alternative, they should be referred to an alternative financial assistance program?
Yeah, so temporary and permanent are 2 completely different animals. So if somebody, we're basically, SOAR looks to target people whose impairment is expected to be 12 months or to forever, basically. So if there's a potential that the person can recover in less than that 12-month period, then they would be looking to do either a temporary disability. If they're working and have to leave work because of the impairment, and it can be mental health impairment or medical, I mean, this happens to a lot of people, but it would be encouraged that instead of saying, okay, I can't work ever again, I'm going to apply for permanent disability, to try temporary, take a leave, see if you can resolve it before moving to a permanent disability application route. I don't know if that makes sense. I mean, there's...
Yeah, no, I think it does. I thought you said that, and I had written down the question, and then after I wrote down the question, I felt like you answered it, so I just wanted to be clear about it. I had another couple of questions in the same vein, but Karina's asking through the chat box, if someone gets denied, how long before they can apply again?
Well, usually when they get denied, there is an opportunity on their denial paperwork for them to make an appeal, and they need to make that appeal within the time frame that the letter stipulates, which I want to say is something like 30 days. So they wouldn't necessarily have to reapply again, but they would definitely want to go into the appeal process, which is what we want to try to avoid. And that's kind of the point of SOAR, would be to avoid that. But if it does happen, which let's face it, right now, it's going to for a lot of people, just making sure that, you know, you're on top of the mail with them. And if they do get that denial letter, to, you know, move to the appeal process, because then what they will do is send out additional information packets to the providers, and then they may even call somebody in for one of their doctors to evaluate. And we don't necessarily always want that to happen because their job is basically to weed people out. So that doesn't always yield success either when we have to go that route.
So we have another question in the chat box. Are these agencies located in other counties, and if so, which ones?
I believe SOAR is nationwide. So, yeah.
And I would think
you can find.
I was just going to say you had provided a website that maybe we could look up. Would they be listed on that website? Other SOAR organizations?
I believe so. I believe there actually is a listing of all of the local leads per county. So I had attended a leadership academy in 2017, so I do have a list of each state. There may be a couple of different leads or agencies per state that can help with this. For us, we have 3, one in Hoboken, one in Margate, and then we have here in Morris County. And that's me. But there is a list, and the website has, and anybody can get trained. You don't have to necessarily go through an agency that does this. You can get trained, or you can have your staff trained for free. And it's all online based, and the only interactive part is when you have to send in your assessment, and then they evaluate it for you and give you feedback, and then they tell you that you passed, and then you know how to do it. But it's very it takes a lot of self-discipline to get through these trainings. It's a lot of reading, unless they've changed it since then. It's been a while since I've taken it, but I know there was a lot of reading involved.
So I wanted to go back to the application. So being that this is for permanent disability status, is there still a need to renew the application?
If they get SSI, oftentimes every 2 years they're expected to recertify, just to kind of, check in and make sure that the disability is still a factor, because it is expected to be 1 year to permanent, but they do want to check in on people every 2 years once they're approved for that and just see if the disability is still there. But if they have SSD, it's my understanding that they don't have to recertify. I'm not really sure why that is, but that's also, they only are eligible for SSD if they've had a work history that's substantial. So SSI is more for people that don't have that work history. So they would be the people that we would look at that have these scattered work history type situations where, they worked for 3 months at Fridays, and then they worked for, they didn't work for 6 months, and then they tried 2 months at ShopRite, and then, if you can show that pattern, that would be more of an SSI candidate if they don't have enough work credits to qualify for actual disability or SSD disability. So sometimes people will send in an application and they'll get a denial because it automatically applies you for both. So oftentimes a person might get a denial letter for SSI because they might be approved for SSD, or they might get a denial for SSD because they didn't have the work credits, but that doesn't mean that they're not being considered for SSI. So sometimes the feedback that they get from SSA can be confusing because they don't realize that they're actually applying for both. And just because you're not qualifying for one doesn't mean that you're denied altogether. It just means that you're not eligible for SSD because you didn't have enough work credits. But we're still considering you for this. So unless you get a denial for both, it's not really a denial yet.
So, but you can submit one application, and they'll consider you for both. So you don't have to get denied from one and fill out another application.
No. it gives you an option when you're doing the online applications, like, do you want to apply for SSI and SSD? And usually you should just say yes, that you want to, you know, put your hat in the ring for both, and then they'll evaluate it and then respond from there.
You may not know, you may or may not know the answer to this question, but I was wondering how many people in the county have a SOAR application completed, like, every year?
I don't have that information.
And then if somebody, so like I was hoping you could speak more to what you were saying about collaborating with service providers. So for instance, if you have a client at agency A, but you're MHA, so that person needs to apply for disability. Is that a referral that they can make to you? Is that kind of what you're saying?
An agency that's providing, sorry,
so, like,
say it one more time.
So if an agency, I'm not being clear. So you had mentioned that it would be that collaborating with the service providers that that are working with the client most of the time would result in more successful applications, I guess.
Yes.
And
yes.
so I was trying to understand, so does that mean that a client is with agency A, like agency B, like there's an agency that's providing shelter services or housing services, and they have a client who fits the criteria, and they've referred them to you, the client to you, to do the application with? Like, is that, like, so is that the kind of collaboration you're talking about?
No, not necessarily, because it's more between the case management entity that's implementing SOAR and the provider. Because like I said, everybody can get trained in SOAR if they want to help. Anybody that helps clients do applications for this should be trained in it, quite frankly, if they can. Because then they will have everything that they need in order to assist that person getting that application done. The collaboration piece that I was speaking about was, for example, if my case managers are working with a psychiatrist in whatever system that is, we do the application with them. But once it comes down time for the provider feedback piece, that's where stuff kind of falls apart, because it's not, it becomes a non-comprehensive application. Because let's face it, doctors are not trained in this. They don't necessarily go to medical school or to learn how to fill out disability applications for their clients. So that's actually where caseworkers are more valuable in that we can help fill all of the questions out so that the disability is clear, because we're spending more time with them than the provider might be. You know, the provider's there to make a diagnosis, but when it comes to the actual functional impairments, there's specific things that DDS looks for when they're making an application. So if we were to collaborate more with the other end of the application, it would probably be more successful the first time. But there's a hesitancy, I think, for providers to take feedback from case managers, if I'm going to call it what it is.
That's interesting.
So,
do you have any ideas on how to bridge that gap? Or anybody else, I guess?
Yeah, I mean, I think when it comes to this very vulnerable population, I think it's something that, you know, should be a conversation amongst providers, to reach out and say, hey, you know, either way, if we're reaching out to them and say, hey, we're really trying to get this person benefits because of this, this, and this, you know, we need to fill out this application in such a way so that we have the best results. I mean, I'm able to do that with our psychiatrist here, because, you know, we work, she's under our umbrella, so we're able to kind of help with the application a little bit more in detail, because they're pretty lengthy, and they almost would require a full appointment, like an evaluation slot with a client to fill it out. So it's not like a 15-minute, like we can, just put our signature on it and get it done type of thing. And I think in the world that we're in, everything is so fast and appointment times are so limited, especially with prescribers and, psychiatrists and APNs, just because of just the world. It's very time consuming to do these. So if we had some collaboration, we can actually write most of the application and just be like, here, check this over. If you agree with it, then we can send it off. We just need your signature.
So I have another question from Lenora. If DCP&P thinks someone may qualify, do we contact them directly for assistance?
If DCP&P thinks somebody may qualify. Contact who? Contact MHA?
Yeah, can you clarify, Lenora, what you meant by that? So if you mean if DCP&P thinks someone, meaning like a family or a household, might qualify, do we contact them, the client, or contact them Mental Health Association directly for assistance? Can you clarify? Okay. SOAR. Oh.
SOAR. Okay. So, SOAR isn't really a place to contact. It's not an agency. It's a method. So anybody can learn how to use the method and implement it for anybody that they are serving that they think is a qualified candidate. So it's kind of putting everything back into your own hands. And if you regularly see people that you think, just really need this benefit because they're struggling and they, have gotten denied before, or, whatever the case may be, you can learn how to do this in order to get their application approved more successfully. And sometimes it doesn't work. Like I said, not only, but 65% of applicants that use this method do end up with success, but it's still ultimately up to DDS. This isn't a guarantee. This is really just kind of educating us and giving us a little bit more of an inside look at how SSA and the disability determination looks at an application to make that decision. So if we can sort of cater to what it is that they're looking for, then it's more likely that we're going to get an approval.
Do you have a comparative statistic about like the total number of applications that are approved? Like is 65% more? Is that less? Dramatically?
So let's see. I have a little bit of older data here. So let's see. I have 67% on average of 101 days from the date of application. I can probably do a little bit more digging on the statistic piece of it, but in 2016, there were 4,134 approvals at a 67% approval rate, and their application was decided on within an average of 101 days. So that's really, it's the speed of it that they're really sort of selling on, is because this is really just a way of writing a good application to increase the chances of a person that's really vulnerable getting the benefit that they need quicker without having to go through the appeal process. So say, 67% of however many, it's 67% of applications that use this method have been approved, not of applications that have been submitted overall, if that makes sense.
So for the percentage of applications approved overall, is that like less than 65%?
Oh yes, most of them are denied, I would say.
Oh. Cool. And the reasoning for that, you think, is because people don't know how to write the applications themselves very well?
Yeah.
Does anybody else have any questions for Danielle? I guess I had one more question. It was what you said about coordinating with the local SSA. That's the Social Security Administration, right?
Yeah.
So has that been done in other areas that you know of?
Yeah. Yeah. I believe in other states they have had a little bit more success. I mean, we tried it back in, I want to say probably 2017, and didn't really get anywhere with it. I mean, the SOAR Training Center recommends that communities try to reach out to their local offices and sort of see if we can kind of get a little bit more of a way in to get them to look at the applications a little bit more quickly. It's kind of like a relationship fostering technique. It's a little bit salesy, and it's less, you know, concrete, hard fact, statistic type of thing. It's more, you know, how we're a very small, close-knit community. I could see this method being successful in this county if we, you know, started implementing some of those collaborations to really get people benefits more quickly. I mean, we already have single stop, which kind of already predetermines what their eligibility might be. So we can use some of that data paired with some collaboration with the providers and actually writing the applications, the initial applications for candidates that we really think are struggling and need this benefit as quickly as possible to resolve their homelessness, because without it, you know, without income, that's a lot of times our barrier. But since I have taken this training, I have noticed that the homeless problem is a little bit more for different reasons than it initially was. Now I'm seeing a lot of people that already have the benefit and are still homeless regardless. So this, it's not gonna, doing this isn't gonna solve homelessness. This is just gonna get them some income, but it's a step in that direction. So I think if we did that collaboration, that the people that really need the income that have struggled to get it might get it a little bit faster. That's the idea that's presented in SOAR. That's like their big claim to fame, is that, you know, we can get more applications approved more quickly. It's basically the take-home message. If you use our method, if you learn how to use the SOAR method.
Okay, so I'm gonna take the risk of taking people off mute who had muted. Again, are there any other questions or comments for Danielle? All right, so I don't see anything in the chat box, and I haven't heard anybody ask a question. I guess if you think about a question afterwards, I'll be sending out the link to the YouTube once it's live to the YouTube video, and then also send out the slides, and I'll send out Danielle's contact information. So if you do have any questions about SOAR or PATH or anything else related to the presentation, you can do so. Go ahead and reach out to her. Thank you so much, Danielle, for being with us today. And I hope everybody is still doing okay. I know we've had a lot of virtual meetings lately, so hopefully they're helping for everybody to feel connected and sort of a sense of normalcy. You know, we are still going about business as usual in many ways, in that we are continuing to do the work of trying to solve homelessness from all these different angles. So thank you to everybody who attended and participated today. Our next webinar is going to be at the end of May on Housing First. I will, I believe I actually already sent out an invitation to that, but I will follow up, you know, in a few weeks with a reminder. That's going to be on May 26th at 2 o'clock. Same back time, same back channel for Housing First webinar with Nadine. And hopefully I'll see you guys again, you know, see in quotes, at the CAS meeting in just a couple of weeks. So unless there's anybody else that wanted to say anything, I think that we're going to go ahead and end the call today.